Hello, I'm Dr. Pankaj Sarange. I'm an interventional pain and spine specialist, and I'm the director of IPC India, that is Interventional Pain and Spine Center. We have branches all over India. We have branch in Delhi, Gurgaon, Rohini, Visakhapatnam, Jammu, and Hyderabad. We specialize in interventional pain. So let me tell you about the interventional pain. What is interventional pain management? So this is a relatively a new branch in the field of pain management. In this, we don't have to open up the spine, or we don't have to do the surgical intervention. Normally, when we go for the pain management in a chronic pain patient, we manage them conservatively. Conservatively means we go for the medical management, we go for the physiotherapy, physical exercises. If that is not helping, then we have another option, that is called intervention, instead of going directly for the surgical intervention. In interventions, what we do is we do under fluoroscopic guidance or ultrasound guidance, or some people also do under the CT guidance. We localize the painful area and we target that painful area, and we try to resolve the painful area from that particular part. Now let me just give you an example what all we can treat with this intervention. Now just take an example of compression fracture of the spine. Suppose there is a fracture of the spine. This is a vertebral body and this is a compression of the vertebral body. Now, few years back, we had only option was to open up the spine, to fix the spine with rods and screws. So that was a major surgical procedure. Now, with the help of intervention, that is called spine interventions, now we can fix this vertebral body, a fracture of the vertebral body, without opening it, with the help of something like this. We can go inside, we can put a cement inside, and we can fix the fractured vertebra without opening the spine with just a small this much of hole. And this all we can do with the help of fluoroscopy. Another example I would like to give you, like we had a heart attack patient with the cardiac problems. Earlier option was bypass surgeries. We used to open up the heart, we used to bypass the block artery, and then this is what the bypass surgery we used to do earlier. But now with the help of angioplasties, we can do under fluoroscopic guidance, we can go inside, we can remove that clotted part, or we can dilate this clotted part, and we can bypass this obstruction over there. So that is possible with the help of cardiology interventions. Similarly, for the spine or other pain interventions, we have these spine interventions available. Another example is that very common problem nowadays. We have seen that a lot of people, especially the young people who have a sitting job, who are just sitting for long hours, 8 to 10 hours, driving for 2 to 3 hours, and that is the main reason for their back problems. A lot of young patients are coming to us with back problem, with slip disc or the prolapsed disc. Now again, initially few years back, we had option like conservative management. We used to give them rest for 2 months, 3 months, but that is not possible nowadays. Now if the person doesn't go for his or her job for 2-3 months, you can understand that it's not possible for them to survive in this competitive environment. So for that, they need a urgent something that without opening the spine, without any surgery, we can do something for them. Now for the prolapse disc, when we see the prolapse disc, that starts compressing the nerve which is coming from the back, and these patient complaints of sciatica pain, that is the pain coming from the back and going down to the legs. Now this pain is because of the compression of the nerve root. So now with the help of endoscopy, it is called a spine endoscopy, spine intervention, we can go inside again with a small, very small hole. We can put a scope inside, that is called endoscope, spine endoscope. We can remove that part which has bunched out, which is compressing the nerve, and we can decompress the nerve without even opening the spine. The same day patient can go home. Even after the spine fracture or spine fixation, we can discharge the patient same day. Morning we do the procedure, and by evening we can discharge the patient, and patient can be moved from the very next day. The advantage of these interventions are we don't have to open the spine, there is no cutting, there is no scar, there is no morbidity. The complications as compared to surgery are absolutely as negligible, I can say, but it's not 100%. There may be some complication with these interventions also, but we can reduce the complication rate to a minimal, And the best part of this spine intervention is we can make them mobile as soon as possible. In just 3 to 4 days, they can be mobile and they can be pain free with these procedures. Another advantage is that the cost factor is very less. As compared to surgery, the cost is almost 1/3 for these intervention procedures. So don't worry about your back problem or the chronic pain problem. No, you don't have to suffer with chronic pain for long. We are there to help you out. You can reach us via our website ipsindia.com, or you can contact us through Labrate. You can book an appointment through Labrate. You can also take an online consultation or the video consultation through Labrate. So we have that facility available with us. Or you can just call us on our, you can go to our website, that is www.ipscindia.com. You can visit our Delhi center, Gurgaon center, Rohini center, or Jammu, Visakhapatnam and Hyderabad center.